I've had death threats, numerous calls, letters. I've had it all.
And since 1995, the potential for a cure has been there. And I actually got involved with the AIDS project while interning at his office. And during that time, I had a little inclination to want to help and reach out to people because there was nothing out there, no cure, so as far as we knew. And Dr. Davis shared with me at that time that he had had in a dream a cure for AIDS.
In 1992, Dr. Gary Davis, a family practitioner from Tulsa, Oklahoma, realized he'd possibly discovered a cure for AIDS. His story would have remained untold but for the extraordinary recovery of a 6-year-old girl dying from AIDS who received his treatment. The pair became national celebrities, but it was the public's reaction to the story that made Dr. Davis's life in America unbearable. Today, Precious Thomas is a normal, healthy child. Yet only 3 years ago, she was given a terminal prognosis.
And I asked about Precious. How's she doing? She says, Precious is doing great. What's she doing? She said, the viral load is 0. I said, oh, excellent. Very good. What'd you give her? I gave her your serum. You gave her what serum? I gave her your serum. How'd you get my serum? She said, I got some of it.
I took it, and with the knowledge that I had, I did what I had to do with it.
You took it without the doctor's knowledge?
Yes.
During this time that she was taking the goat serum, she was also being monitored by the doctors at NIH, wasn't she?
Yeah.
Records at the National Institutes of Health show Precious's HIV levels dropped from 186,000 to 0.
I was motivated to participate because of a friend of mine. He died from AIDS, and I remember wanting to do something in honor of him, but I didn't know what to do. And I had conversations with another friend of ours, his name was Keith, and he would always talk to me about doing something in honor of Cedric Leonard, who died from AIDS, but we didn't know what to do. So as a result of meeting Karen Fuselier-Jones, we found our answer. And our answer came through Dr. Gary R. Davis and Karen's project to present a film entitled A Foreigner in His Country.
Dr. Davis, a Dartmouth Medical School scholar, discovered that an antibody serum extracted from goats prevented this deadly viral fusion by destroying the invading virus dead in its tracks. And because a goat's immune system is so similar to our own, Dr. Davis was led to conclude that goat antibodies could stimulate our own immune system to overcome the invading virus. The vital support came finally from one of North America's most renowned research institutes, Tuskegee University, where Professor Walter Sapp and his immunology team risked their considerable joint reputations to help Dr. Davis with the initial preparation of the goat serum.
In 1995, we received killed HIV. The virus was injected into 2 goats. After that period of time, blood was drawn from the goats. The antibodies were precipitated and purified and given to Dr. Davis. The in vitro testing was done by Dr. Pauline Jolly at the University of Alabama at Birmingham. Well, the results of those tests were absolutely what was hoped for and expected, and that is that the serum prevented viral fusion of cells.
For over 6 years, Dr. Davis has been attempting in vain to enlist assistance from the National Institutes of Health, whose given role is to research and evaluate new medical treatments. There is no explanation for the NIH's lack of cooperation.
Other AIDS experts are skeptical of Dr. Davis's work. Dr. Anthony Fauci of the National Institutes of Health.
Not only is there not any basis for it to work, but there is evidence to the contrary that it won't work.
And despite numerous requests, they have repeatedly refused to be interviewed for this program. However, our evidence can reveal that for the last 6 years, the National Institutes of Health have had positive proof that Dr. Davis's serum works under laboratory conditions. Proof they received in a report sent to them by one of their own researchers, Dr. Pauline Jolly, from the University of Alabama, who originally tested the goat serum in 1995 for Dr. Davis. Her study proved that the serum blocked cell fusion, and the AIDS virus was killed in less than 7 days.
Just like they're sitting there in that audience thinking it can't happen to them, I was sitting there with the Lakers thinking it couldn't happen to me. I thought I was invincible.
The one issue that tends to unite young people around the world is this issue, HIV/AIDS.
And we're still the ones that are going out there and getting infected all the time.
A national survey says 1/3 of sexually active teens do not use condoms, and fewer than 1/3 of sexually active teens have ever been tested. Many other organizations are alarmed by what's happening in India. Best estimates are that 5.1 million people are infected here, second only to South Africa. Even more frightening, by the end of the decade, that number could increase 5 times to 25 million.
This is a 10 cc vial of the goat serum. As you can see, it's clear, and it is a concentration of the goat's IgG antibodies. The goat makes basically an IgG and an IgG1, and that's all the antibodies that it makes. On the other hand, human beings make 5 different types. The beauty about this particular antibody is this will pass all the blood-brain barriers. It will pass across the placenta. It's one of the antibodies, if you're going to pick one to have, to give to human beings, that's the best kind to have.
It's almost like someone has given me a miracle.
My CD4 prior to treatment was 359. 30 days later, it was 598. My CD8 before treatment was 562. 30 days later was 923. And that is on 0 medications.
The viral load refers really to the amount of virus in the body, just quite literally how many viruses are in the body. And it can be measured very easily by taking a sample of blood and just looking at the concentration in a certain amount of blood, how much virus is there. That's referred to as the virus load and used to monitor treatment. And basically the higher it is, the worse the disease, the lower it is, the better.
I must say that I've always had a passion for wanting to help people, and of course I wanted to see a cure for AIDS because I lost a dear friend. But when I met Karen, it went to a whole nother level because I saw her passion. Whenever Karen would talk about Dr. Davis and his potential for a cure of the AIDS virus, she would light up like a Christmas tree. And she told me one day, she said, "Harriet, I believe that I have to get this message out to the world. And I'm not sure exactly how I'm going to do it, but I will do it." And then eventually, days later, maybe a month or so later, she came back and she mentioned that she felt it deep in her heart that she is supposed to do a film, and the film will be titled "A Foreigner in His Country."
Actually, I'd like this to be the start of bringing a foreigner, the foreigner, Dr. Gary R. Davis, back to his country without any hindering forces or opposing forces stopping him from pursuing his research in whatever area he deems necessary.
I just can't give up now.
See, man's intellect, something wrong with it. It's war.